South Africa's government began vaccinating its health workers in mid-February, with 80,000 receiving the jab so far. For some, like Dr. SULIMAN, the rollout's been slower than expected. He runs a private practice in KwaZulu outside Durban. He says he's registered to be vaccinated, but his appointment's been cancelled.
It has been tough working. It's not easy working in a closed environment, having PPE in all day. We do our own swabbing here, or we've been treating patients directly and telephonically. So it has been pretty stressful, particularly when you go home and pass this thing on to your family, which I've done.
There are more than 67,000 healthcare workers in KwaZulu-Natal province alone, of which fewer than 2,000 have been vaccinated.
I think the problem has been about maybe the allocation, because we were given something like 10,000. But I know that there are healthcare practitioners, especially doctors, who registered and they were allocated a slot, but they've since been rescheduled. I think it has been a planning process.
But many healthcare workers are still waiting as they continue to work in high-risk environments. Scientists say it's important to vaccinate people as quickly as possible. But Johnson & Johnson's donation of its vaccines in batches of 80,000 doses every 2 weeks has worried critics, who are also questioning if this is indeed a rollout or nothing more than a clinical trial by the US pharmaceutical giant. The government says it's part of an early access and monitoring program, and it has to investigate how effective the Johnson & Johnson vaccine is against the new, more contagious strain identified here in South Africa.
Latest by end of May, we must have vaccinated 1.2 million healthcare workers. Now, if that is the case, then it means then that the slow rollout that we are doing now is really slow. We should be vaccinating 80,000 to 100,000 people a day, instead of about 5,000 to whatever, 10,000.
Millions more doses from other companies like Pfizer are expected to arrive, possibly from April, to expand the rollout. While South Africa is now at the end of a second wave of infections, there are concerns of another wave as soon as April. And a slow rollout and the winter months ahead have experts worried. Fahmida, Jazeera, Johannesburg, South Africa.